I'd like you now, Fred, to come to this seating platform and sit squarely on this platform, placing your base of ischial tuberosities, or the bottom of your buttocks, the bottom of your pelvis, squarely on that platform. So you sit squarely on that platform, Fred. Fred, I'd like you to let your arms hang freely at your sides. I want you to feel totally relaxed, be totally at ease. I want you to take several deep breaths. Consider the importance of this decision process, establishing a stabilized, balanced posture for the rest of your professional life. I am now going to elevate and lower the seat upon which you're sitting and have you experience the range of movement possible with this seat. I'll first elevate it to its highest extreme, then lower it to its lowest extreme. I'll do this more than once so that you become familiar with the extremal limits in this range of movement. Now I'm going to elevate and lower this seating platform in increments. The first thing I'm going to do is elevate it in increments until you tell me that it is too high in terms of what your body's internal sensors tell you. Essentially, we'll be going up and down, diminishing that range of movement, establishing a narrow bracket which ultimately you will split at that point, which is just right for Fred Clefts. I'm now going to raise the stool. Stop, did you say?
It's too high.
Too high? All right.
It's too low.
Too low. Notice that we are making large incremental movements initially.
Too high. Too low. Too high. Too low.
You feel that is the correct seating height for you? Our objective in establishing an ideal seating height is to establish for you a stable, balanced posture for your lower body, by which we overcome the force of gravity, stabilize our lower body, and establish a base upon which to stabilize the rest of our body, ultimately to perform and control performance. I would point out that that last change, in fact, several of the more recent adjustments have been within the range of a fraction of a centimeter. It is a very precise determination, therefore seriously telling us that arbitrary seating is certainly out of the question for a body so sensitive to what is correct by one's proprioceptive awareness. I want you now to consider all the possible positions you can place your upper body. You can obviously lean forward, you can obviously lean backward, you can obviously lean to each side, you can twist your body at the trunk. All those are in the range of your options. Please identify that position or attain that position which you believe, according to your body's proprioceptive sensors, to be that most stable, balanced, comfortable position of your upper body, and one that you could maintain without artificial support for a considerable period of time. All right, I want you to do the same thing with your head now. Consider all the possible positions in which you might place your head, and then find that which is most stable, most balanced, most comfortable, and which you could maintain without artificial support for a considerable period of time. I want you to imagine that in one hand is a needle, and the other hand is a thread, grasped between those thumbs and forefingers. Thread that needle by making the necessary forearm movement, essentially bending at your elbow, and bringing your needle and thread together at a point in space where you could thread that needle, at a point in space that you feel you have the greatest control of that act. Please do so. Recall that you would like to have your arms loosely hanging at your side if you could, that you'd like not to alter any portion of the body posture you have already established, but that which is necessary to thread that needle. Do not consider vision at this point. Have you found that position?
Right here.
Okay, please hold that. At this point, I'd like to identify the relationship of the superior border of Fred's tragus to the outer canthus of his eye, and to have you note that the line taken from one point to the other identifies a slight elevation from posterior to anterior. Note also that at this point vision has not been involved. We have merely had Fred respond to his proprioceptive senses. In a moment, Fred, but not until then, I'm going to ask you to open your eyes and simply place them upon that point. If at that time you are inclined to lower your head or to raise your hands, in no case do I wish you to do that. The only movement that I want you to effect upon my command is opening those eyes and trying to put those eyes upon that point where your fingers come together. Please do so. Can you see that point?
Barely.
You say barely, or with difficulty?
Yes.
Okay. Please bear in mind that I am not concerned with the quality of vision, simply can you see that point? And you identified to me that you can barely see it, or that you see it with difficulty. What would you have to do, or what would you want to do to better see that point?
Either one, tilt my head down, or two, bring my hands up.
What would you prefer to do of either? Drop your head?
It's easier to drop your head.
I mention that because you've already done that, but drop your head?
Because by doing this, it's harder on the arms. It's easier to keep my arms here.
I see. There's the range of adjustment that you would make from a balanced initial head position. The range of adjustment that you would effect by dropping it would be more comfortable than adjusting your arms and your hands to overcome this difficulty of seeing. Is that what we're talking about?
I have more balance if I just drop my head a
More
little.
balance if you just drop your head. And your head position, once you drop it, is still within an acceptable range of comfort and balance and stability? Is not an uncomfortable head position for you?
No, it's not uncomfortable.
Okay. You have now established a stabilized, balanced posture by which you will overcome the force of gravity. And because of the stability, and because of the comfort, you're able to probably optimize your potential for performance and control at this point in space, which we call the optimal control point. You're able to see this point as you must, and you're able to do all this without compromise of your body's natural inclinations or the proprioceptive determinations that you have made. The objective at this point, of course, will be to maintain this balanced posture as we perform all common procedures in dentistry. While I should have mentioned this next point earlier, I will mention now that when Fred dropped his head to better see that point, that canthus tragus line, previously identified to be elevated from posterior to anterior, is now at the horizontal, but only after Fred accommodated for vision. Power of this optimal control point is that we now have an established preferred working point to which we can set focal length, to which we can relate other armamentaria of the dental work environment, to which we can, of course, in fact, initially set the patient's oral cavity so that Fred can sit and work this way without compromise. Without the identification of this proprioceptively determined optimal control point, nothing else can be set or determined